It's 1:30 a.m. at the night, and I'm sitting here. As I see the whole world is frightened, there is a flurry of messages in my WhatsApp, and I cannot avoid reading one after another. At least I get something very important. There is a mixed bag of information, misinformation. Nobody is spreading misinformation intentionally. Everyone is in a state of panic. So, whatever people are getting, whatever they are receiving from other sources, they are just forwarding it. They might think that some of it might be helpful to others. Sometimes a state of being in a prolonged lockdown, a state of uncertainty, how far this is going to go, how far this is going to continue, whether at all this is going to stop. I've spoken to many of my friends today. Some of them sound very pessimistic, some of them sound very optimistic. Frankly speaking, personally, I do not know whether it's the right time to be directly pessimistic or optimistic about what the outcome is going to be, because I understand at this point of time nobody really knows what's in store for us. Being a doctor, I do not have the option of staying at home all the time, and more importantly, there are a large segment of people who belong to my fraternity who do not have the option of staying at home. Being a doctor in these times all over the world is being like a soldier during the World War times, and what the entire world is going through, maybe it's not a conventional world war, but this is a kind of world war where the entire humanity is at risk, and we are fighting against a tiny invisible enemy, a virus which otherwise would not have an independent existence if it doesn't have a host. Its host is human beings. The virus is the biggest enemy. Unfortunately, we do not have a cure for it, we do not have a vaccine for it. The only option for most of us is to stay locked down and expect that by that we will break the chain of transmission. For people like me, for doctors who have to go and work in the field, we just hope that we get enough of personal protection kits, personal protection equipments, masks, and of course, we would expect that people would behave responsibly, especially those people who have a risk of exposure, who have symptoms that might be indicative of that they have got some respiratory problem which needs specialized care. They should not hide their symptoms. Please do not hide your symptoms before you come to a doctor, especially because that doctor is going to see a number of more patients. The hospital people are going to get exposed to you. Something similar is happening in different parts of the country, which actually is a very big risk, which is a potential cluster bomb which would actually endanger a lot of people without their knowledge. So it's a responsibility for everyone that they should reveal their travel history, their contact history. That is one thing. Second thing, it is also the time that apart from doctors, we have to acknowledge and thank the number of people who are risking their lives, who are risking their a lot of people would love to stay at home, but they have to come on the streets. The policemen are doing a wonderful job. As I can see in my city, Bhubaneswar, everywhere the city is locked down, and to ensure that it is locked down, the police are there on duty. Even they are checking people uh, everywhere, wherever it's possible. The other kind of people who are very important is, of course, in my sector, apart from doctors, the nurses, the other healthcare related workers, the people who are not directly giving health related care, but the people who are housekeeping staff, they will have to routine maintenance of the hospital. There are other people in the government sector who are actually risking their lives and coming to work every day. People in the administration who really have to see that things are in place and where what needs to be done. Even our political leaders are behaving so responsibly these days. That's something very important and very appreciable under these circumstances. So I would expect that all of us would behave in a very responsible way and respect whatever laws are being formulated by the government, and unnecessarily do not create a lot of problems for the government, for the administration, And of course, do not spread misinformation. If you're not sure of the authenticity of the source of the information, then please do not forward something like that. That is going to create a lot of trouble for people, for because every day everyone has got a smartphone in their hands, and people would like to emulate whatever they grasp from those pieces of misinformation. So it's the best time to stay locked down in your homes. Focus on, as I had said in one of my earlier videos, focus on yourselves, focus on self improvement. You go for exercise, go for a healthy diet, go for having an emotional bonding with your family members. You can have some good movies on television, you can read some good books, you can engage in indoor sports. And if you have some good habits or hobbies like singing or musical instruments, you can focus on those things, because that's how you're going to actually constructively spend, because we do not know how many more weeks we are going to keep stranded and how the world is going to come out of it. In between, we can only hope that the virus we can only hope that we break the chain of transmission of the virus and the entire world soon comes out of it. Let's hope for the best. That's our best bet at present. Thank you.